Good afternoon, ladies and gentlemen. My name is Professor Alessandra Fanciulli from the Innsbruck Medical University, and I have the sad honor today to remind us of a person whom we have lost earlier this year, Professor Gregor Wenning, who was the head of our department and a world acknowledged researcher in the field of multiple system atrophy. Multiple system atrophy, a disease which he often used to describe as a wolf in sheep's clothes, due to the difficulty of identifying it early in the disease course. Professor Gregor Wenning was born in the region of North Rhine-Westphalia in Germany on the first day of spring in 1964 to Karl-Heinz Wenning, who was a teacher, and Elisabeth Wenning, who was a secretary. Gregor's father died during his teenage to a severe neurological condition, and this admittedly influenced his later decision to become a neuroscientist, but also the strength which his mother had in raising the four children after their father's death was something which left an important footprint on Gregor's personality. And indeed, his mother was able to support him when he decided to go and study medicine at the Münster Medical University. And here, during the university studies, Gregor also received a stipendium, a bursary of the Studienstiftung des Deutschen Volkes, which is a foundation supporting the university education of young people who, on account of their exceptional academic or artistic talents and personality, are expected to make an outstanding impact on the society as a whole, which Gregor surely did with his later career. After the medical studies, Gregor moved to London to the Queen's Square, where he had his PhD under the guidance of Professor Niall Quinn, whom you see here in this picture, and you see on the right a young Professor Wenning, and those who knew him know that when he had this face, this expression on his face, he was thinking his bit of the story during this conversation. And indeed, during this time, Gregor produced amazing works on the natural history of MSA, which are even 30 years after their publication, citation classics, as you see here. But the London Times was also a very interesting time under a personal point of view, I believe, because there Gregor met many of the colleagues whom he later worked with during the following years. And he also met Professor Roberta Granada, his wife, and together they had two wonderful children, so Maximilian and Marco, and they were the pearls of Gregor's eyes. These are pictures which he often used to share on Sunday afternoon, just to share the beauty of his family. After the London time, Gregor met Professor Werner Pöwe, who convinced him to move to Innsbruck, Tyrol, where a very long-standing, over 30 years cooperation started, a very profuse one. In Innsbruck, indeed, Gregor first completed his residency in neurology, his training in neurology, and while still training in neurology, he already had his habilitation as professor of neurology. This was the day of his habilitation, and to motivate us, he once shared this photo telling, so you will look like when you manage to achieve your habilitation in neurology. And since 2006, he was indeed a full professor of neurology and chair of the clinical neurobiology unit, which is still today composed of a laboratory for translational neurodegeneration research and the Innsbruck Dysautonomia Center. At the Medical University of Innsbruck, Gregor was also a Senate member of the university. He was a passionate lecturer, and he did not only dedicated his mind and creativity to research, but also sometimes his own flesh, as you see here, where he was donating a skin biopsies for research purposes. Professor Wenning was also the founder and the first president of the Otto-Loewi-Gesellschaft, so the Austrian Autonomic Society, which was grounded in Innsbruck in 2017. And thanks to his initiative, Otto Loewi Memorial Lectures were given to outstanding researchers in the field of autonomic neuroscience and multiple systematrophy or movement disorders, such as Professor Niall Quinn 2017, Professor Max Hills 2018, and later on Professor Pöwe in 2019. Professor Wenning was also the founder and first president of the Bishop Gorsa Foundation, which is a Italian foundation dedicated to supporting research in atypical Parkinsonism, also conveying scientific awards to worldwide acknowledged scientists, first Professor Gabor Kovacs and Professor Vic Kurana 2018, later on Nobel laureate Professor Stanley Prusiner 2022, Professor Singer, and this year Professor Michel Godet from Cambridge in the UK. One of the many talents Professor Wenning had was his leadership abilities, where he was able, which made him able to coordinate multiple international consortia, such as the European MSA Study Group, which initiated natural history study and also interventional studies in the setting of multiple system atrophy, but also the MDS MSA Study Group, the MODIMSA Study Group, which Gregor chaired for many years. Also in Austria, he was a board member of the Austrian Parkinson's Society, and at the European level, he was a board member of the European Federation of Autonomic Society and of the European Academy of Neurology. He also made contribution to. For the MDS, in recent years, he coordinated the revision of the diagnostic criteria for MSA, which was ultimately published in 2022. And he also had tight bonds with many MSA patient advocacies. He was a chair of the scientific advisory board of the MSA coalition, now Mission MSA, and he also cooperated with the Defeat MSA Alliance. Overall, Professor Wenning was an outstanding clinician scientist with incredible metrics. He had over 600 publications and a Hirsch index of 112 and published over 50 books and book chapters, including the first monography on MSA. Over his career, he collected more than 10 million euros for MSA research and received multiple research prizes. But one of the biggest talents he had was being a very thoughtful mentor. One of the first people he mentored was Professor Nadia Stefanova, whom he developed the laboratory for translational MSA neuroscience with here in Innsbruck. And they established together mouse models of MSA, which served later on as test beds for new disease modifying compounds. And some of Gregor's mentee made a name for themselves, like Professor Sonia Scholz, who is now working at Bethesda and recently shed light on the genetic contributions to the pathophysiology of multiple system atrophy, or Professor Klaus Seppi, who wrote guidelines for the treatment of non-motor symptom in Parkinson's disease, or Professor Christoph Schaffler, who is a neuroimaging expert. From the next generation of MSA neuroscientists mentored by Gregor, one of them is for sure Dr. Krismer, whom he worked together with to analyze the data from the natural history of MSA, which served as a basis for sample size calculation for disease modifying trials. And as it regards to myself, probably the most famous work we have done together is the review, the New England Journal review on multiple systematrophy. And there is a funny anecdote to tell here, because one of the research meeting we had just shortly before my maternal leave for my second child, Gregor proposed almost as a joke whether we should send a proposal to the New England editor for a review on MSA. And the editor, of course, did not take this as a joke, but said, yes, please. So this was the background of this MSA review, which you might have read. This to say that gender equality and equal opportunities for all co-workers were not just empty words for Gregor, but a conscious decision that he took every day when he was mentoring his team. In later years, Gregor was also very supportive and helped us to receive major funding for medical decision making in multiple systematrophy. This you see is one of the meeting of this research team, which is a dedicated team at investigating the efficacy of a multidisciplinary personalized model of care with integrated telemedicine and mobile palliative support in ameliorating the quality of life of people living with MSA and their caregivers throughout the disease course. And we hope to be able to share positive results soon about this study. Of course, Gregor was not only a researcher, was not only a mentor, he was a very religious person and a person who cared for his own family, for the family he came from, for his friends, who liked to travel, to have fun with the people he worked with. And we immensely miss this person and mourn his loss. But he left us with an important message, which he shared also in this interview here, and I would like to play for you.
So at this stage, I would like to raise some hope for all of the patients affected by MSA. And I would also call upon my colleagues, the neuroscientists and the neurologists, to continue their fight against this devastating disease. So please support MSA research wherever you can, wherever there is a research group near you. And I really encourage you to support the cause of MSA. Thank you.
And this is a mission which his team here in Innsbruck and their collaborators worldwide are very eager to carry on. Thank you for your attention.